Hello everyone. We made it to another Monday. Hope everybody had a great weekend. The weather was certainly fabulous. So I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department here on Monday, November 16th, I think. I'm here to give you our report of the impact of COVID-19 pandemic on Mobile County. Worldwide, we're creeping up on 55 million cases with 1.3 million deaths. In the United States, we went over 11 million cases of COVID-19 over the weekend with 247 almost thousand deaths. You've probably seen on the news that late last week we hit record numbers of COVID cases reported daily in the United States. Today in Alabama, 219,232 cases with 3,249 deaths. One comment on the Alabama Department of Public Health website, it posted two notices that a backlog of results were processed on 11/14 and 11/15, which rather small backlogs, but 152 yesterday and 109 on Saturday that were processed through the ADPH website. So if it affects the number of reported, but it does not affect the indicator risk dashboard. So today in Mobile County, our weekly report that's done in collaboration with SSI Group, we're reporting on 18,674 cases of COVID-19. 58 were added Sunday, 68 were added Saturday, and 129 were added on Friday. The cumulative number of Mobile residents who have died with COVID-19 is at 342. The cumulative number of people hospitalized in Mobile hospitals is 2,448. That was an increase of 5 since yesterday. And when we look at the current number of people hospitalized, yesterday there were 96 hospitalized with COVID-19. So we have seen that trend of the number hospitalized creep up. We'll talk a little bit more about that in a sec. So our weekly report came out today. I'll just point out a couple of things that are noteworthy. Let's see. So if we look at the number of cases reported in the last 7 days to the 7 days to 2 weeks ago, we had a 45% increase in the number of cases in just 1 week. So again, rather alarming increase in the number of cases reported. If we adjust how we count those, looking at the infectious date or the date that the case was most likely to be infectious with COVID, we're about flat. Not much of a change from last week to the 7 days before that. Let's see. A couple other things. We are still seeing, we talk about this a lot right now in the fall since school went back and colleges went back. Most of our increase is in those younger age groups. So there is a 73% increase in COVID-19 cases reported among people aged 18 to 24 years of age compared to all other age groups. And yet we still see the largest number of cases reported coming in that 25 to 49 category. So definitely those 18 to 50-year-olds still seem to be driving transmission in the community. So our 7 and 14-day moving average number of cases reported, if we look at it by the infectious date, which again tries to smooth out some of those aberrations caused by the report date. If we look at by infectious date, we're seeing on average about 75 cases added each day, and that is an increase. And again, with hospitalizations on average, now we're seeing about 95 cases on average each day of people hospitalized with COVID-19. That's compared to I think our lows were down in the high 60s and 70s, and we are getting back up nearing 100 cases hospitalized each day with COVID-19. This is concerning, of course, because what we try to do with our public health mitigation strategies is slow the spread of COVID-19 so that we can limit transmission to patients with underlying medical conditions, who are elderly or who are obese, and prevent a lot of complicated illness that might drive people to the hospitals because we don't want to overwhelm our healthcare system. Our number of deaths have begun to rise. Again, when we see a large increase in cases, usually within 10 to 14 days, it's followed by an increase in hospitalization, and then sometime later, followed by an increase in deaths. And we are starting to see that number of people who have died with COVID creep up ever so slightly, although only 7 were reported to us last week. That's still much better than it was in the summer when we were seeing our peak number of cases, but we want to keep that number as low as possible. Looking at the percent of laboratory tests that are positive for COVID through our traditional public health surveillance systems, that is largely driven by mostly PCR, but some, the places that are reporting both positive and negative antigen results are also included in this calculation. But through our standard public health surveillance, we're seeing around 7% positive, but the facilities that are reporting directly to us that aren't included in that number are seeing upwards of 18 to 20% positive. These are, again, the rapid testing locations where you might think that people who are more apt to have COVID, have been exposed, have symptoms of COVID, may self-select to go to these rapid testing locations because they want a fast result, and that might be biasing their numbers towards the higher end. We have a new couple of figures in our weekly report today. Table 5 gives some information on schools. So COVID-19 school cases reported to the Alabama Department of Public Health, and this is for the week between November 8th and November 14th. There were 114 new cases reported in school-aged children. Looking at, an active case, so looking at cases that are still within their 10-day of isolation period where they're likely to be infectious, there were 132. Most of those had laboratory confirmation. We have 35 schools reporting last week with at least one new case. That was added on top of about 40 schools that were already reporting, and we have 8 schools that are reporting 3 or more active cases. So this would be sort of what we're considering an outbreak status. Really what it means is that we have an outbreak in school-aged kids in these areas, right? It's really difficult to determine if they were exposed at school or if they were exposed at an after-school or preschool activity, or perhaps were exposed by hanging out with their friends after school and on the weekends. So those things are really hard to tease out. We know that schools are doing everything that they can to try to protect children while they're in school. But again, when we see cases in school-aged children, then we associate those with the school that they go to, even if they may have gotten exposed outside of the school location. So a couple other things. Talking about outbreaks, we currently are monitoring outbreaks in at least 5 long-term care facilities, 1 congregate setting, a physician office, and several other places that we are hearing about. And I want to remind people that if you are the manager or the owner of a business or an agency or a doctor's office and you have COVID positive employee or customer or patient, please give us a call and talk through your response with us. We're here to help interpret guidelines, to help make sure you have all the personal protective equipment that you need, to provide rapid testing if it's needed. We just need you to give us a call, or you can email us at covid19@mchd.org. And we still really want to hear from members of the community that hear about clusters of COVID, because we don't always get a call from the owner or manager. So it's the stewards around the county that let us know when they hear of things, that really helps us sort of pinpoint some of the locations where there have been clusters of COVID that we did not detect through traditional case investigation and contact tracing. So just wanted to let you know about those outbreaks as well. And outbreaks of any infectious disease, communicable disease, are required by law to be reported to the state health department, and we can assist you and want to assist you in making that report. On Friday, someone from the media asked me to report on the number of complaints to our IS complaints email address. Since we began tracking in late July, we have received and responded to 274 complaints. Last week there were 10, one for a convenience store and 9 for a food establishment. And we also receive and track complaints on schools, on non-permitted businesses, on churches, just big box stores. It runs the gamut. So again, either if you have a complaint or if you want to report COVID, you can email us at covid19@mchd.org, or you can send an email to iscomplaints@mchd.org. And just wanted to answer a couple of questions and report on an announcement from the State Health Department. We've gotten some questions about restrictions to interior restaurant dining. I mentioned on Friday that the amended Safer at Home order still requires wearing of a face covering when 6 foot distance can't be maintained, and it still prohibits non-work gathering that cannot maintain 6 foot distance. But those limits on the percent of capacity that restaurants could fill based on retail establishments also, those things were all lifted. So it means that restaurants can go back to full capacity, but there are some things that they have to do to accommodate, like putting some dividers between the tables, and there's some other things. So the question was that I expressed concern on Friday about that, and can we anticipate the health department considering additional restrictions in the coming days? And none are being considered at this time. Also, a question about vaccine distribution. Lots of questions about vaccine. So let me see if I can handle these. And this is not from the science of the vaccine. That is for Dr. Scott Shavers to talk with you about. This is more sort of about the logistics of vaccine, talking about the plan for distribution of vaccine in Mobile County. And as you might imagine, Operation Warp Speed, so the effort to get the vaccine out into as many arms as possible, as quickly as possible, they have a very elaborate and very well conceived vaccination plan. The State Health Department, the Alabama Department of Public Health, submitted a vaccine plan to the Centers for Disease Control, and CDC's provided some feedback, and Mobile County is participating and following along on with those plans. So it will be a coordinated effort both at the state level and nationally as the vaccine comes out. Early on, the vaccine is going to require ultra low cold storage, and someone was asking about, are there places in Mobile County that have this type of storage? And the answer is yes. There are several locations, including 1 or 2 large hospitals, that have ultra low storage and will be able to receive some of the first shipments of vaccine that will be targeted toward healthcare providers and first responders and then the elderly. But all of this is really unknown at this time. How many doses we're going to receive, who they're going to go to, because the process of finalizing the vaccine and FDA providing emergency use authorization for those, FDA has to review the data, and then once they give the approval for the EUA to be submitted, then the vaccine will ship to some pre-designated locations where it will be held for distribution, so that when the EUA is approved, that a couple of locations around the state, in this first round, I think there are 6 locations, will be able to start giving vaccine. Then some questions about the efficacy of the vaccine. Do I think the 90 to 94% efficacy is trustworthy? Yes, I do. Lots of eyes on all of these data points. So I do believe that it's actually great that it looks like it's going to be much more efficacious than the seasonal influenza vaccine. But remember, with influenza, there are lots of strains of influenza circulating worldwide that have rather large differences. And so those are some of the reasons why a single vaccine is not as efficacious as The SARS-CoV-2 vaccine looks to be with 90 or 94%, depending on the manufacturer. With SARS-CoV-2, it's a single strain, right? Some minor genetic differences based on the geography, but not enough to fool the vaccine. So hopefully that will work to our advantage. And then someone asking about, do we think that the second wave will be worse than the first? It's really impossible to tell. You know, during Spanish flu in 1918, the second wave was much worse than the first because sort of a hyper immunogenic phenomenon occurred in people, and it made them much sicker than the first time around, and we just don't know, have no way of knowing what's going to happen with COVID. We hope not, but it's just, you know, we're all in this big experiment together, so we will all learn as we go along. All right, could Dr. Murphy discuss hospital bed capacity? And are we concerned about spikes? So people have asked me, you know, do you think Halloween and the fair contributed to increase in cases? I don't think they do. It's most likely, it's probable that they did. Anytime you have large numbers of people gathering, whether inside or outside, you are increasing the risk of COVID transmission. So certainly the fair, things like large gatherings around Halloween, things like large gatherings at Thanksgiving are going to increase our risk of transmission, absolutely. What we hope is that people will take precautions to reduce transmission to the most vulnerable populations so that they don't get sick and require hospitalization and then create a critical bed shortage for ICU beds. That's what we're trying to do, is, you know, flatten the curve, slow transmission as not to overwhelm our hospitals. Right now, our hospitals are, several of them are at maximum ICU capacity. That, you know, they have most of their beds in use, but we know that they have a great ability to flex. Back in the spring, you know, non-essential services or surgeries were canceled for a while to make sure that the hospitals were able to handle the load. So there are other things that we can think about, but right now it looks like the Mobile County hospitals are holding their own when it comes to ICU beds and the number of COVID patients. And then some questions about Mardi Gras and decisions about Mardi Gras. I think that, you know, the health department, right now, it's a little bit too early for me to think about recommendations for, you know, advising people to travel in February or to go to have a Mardi Gras party or to do anything, honestly, to have a birthday party, to have a wedding. If anyone asks me, should I be doing this in February, my answer has to be, it's too early for me to make some recommendations because we just don't know what it's going to look like in February. Right now, we're under a statewide mask order, a amended Safer at Home order that says you have to wear a mask if you can't maintain 6 feet, and it prohibits non-work gatherings if 6 feet cannot be maintained, and that is through December 11th. So I can absolutely tell you right now that there is a prohibition on non-work gatherings where a 6-foot physical distance between people of different households cannot be maintained. What things are going to look like in February, I do not know. So what we will do is, when the time comes, is we will make decisions and make recommendations. I mean, we've not closed anything yet in this outbreak, so I doubt that we will get into the business of just, you know, telling people that they have to cancel, that they have to close. We've not really done any of that since the day one of this outbreak, but what we will do is make recommendations based on the very best public health information, surveillance information that we have at the time. So we'll consider the availability of hospital beds. We'll consider the % positive of testing and the availability of testing. We will take all of those things into consideration. You know, if the governor continues extending the Safer at Home order, then we will support that. So it's really just too early, but we always take into consideration things that are going on, you know, about the time, which is why it's very difficult to make put out some forecasting about what what we might say in February. All right, let me just take a look at these and see. Someone on Facebook was lamenting that a Mississippi county just across our border is doing things a little bit different than the state of Alabama, and just sharing some concern about, maybe not requiring kids to quarantine, where in Alabama we are. And we know that COVID does not respect the state line, but there's very little that we can do about this, except that if you have children in Jackson, Mississippi schools, or in George County, Mississippi schools, please encourage them to wear their mask and wear it all day when they're at school. Just because it's not required doesn't mean that you shouldn't do it. So certainly wearing a mask when you're at school and staying at home for 14 days if you've been exposed is the right thing to do in any situation. And I think that's it. So anything more?
ADPH letter.
Yeah, Mark just wanted me to mention that the Alabama Department of Public Health is going to put out, or maybe has already put out a news release. I think it's linked on our Facebook page. Yes. Just reminding everyone that everybody in Alabama who wants COVID vaccine will be able to get COVID vaccine at no charge to them eventually. It may not be until mid-2021, but the health officer and just the ADPH just wanted to make sure that everyone knows. Let me see if I can read this. All Americans can receive their initial vaccine treatment without any charge, including people with no health insurance. And Dr. Harris emphasized that the goal is for all people to have access to the free vaccine, regardless of their financial status or location. Distribution of the vaccine will be made equitable to those most at risk, the chronically ill, and seniors in all 67 Alabama counties. So please don't get too concerned if you are not vaccinated in this first round. The federal government and the Advisory Council on Immunization Practices will make the recommendations about how those first doses should be prioritized. And then as we get more and more vaccine allotments, then the vaccine will be available to more and more people. But we certainly want to make sure that we protect our healthcare workers, our first responders, and those over 65 who are most vulnerable to severe complications first. And then the rest of us, as the months go on and vaccines get approved, then we'll be eligible to get vaccinated on into 2021. All right, I got the thumbs up, so it's time to go for now. We'll talk with you again on Friday at 2:30.